So I'd like to now invite Dr. Natisha Mazzouli to get us started. Natisha, can you share with us from your experience and the work you've been doing over decades, what are you seeing as the impact of anti-Black racism and anti-Blackness on health and well-being?
Let me make sure that you can hear me first.
Hello, Natisha.
Yes, you can hear me?
Yes, we can.
Okay, perfect. Just in terms of anti-Black racism, specifically in the impact on health, you know, the old way of thinking, and I call it an old way of thinking even though many of us still engage in this concept, that racism is a determinant of health. And I call it an old way of thinking because what we should be looking at is that racism and anti-Black racism specifically drives and amplifies each and every social determinant of health. So if we look at education, for example, the determinant of health, the impact of anti-Black racism on students, Black students, and their inability to effectively gain appropriate education in the Canadian system obviously is a driver of determinant of health that has been amplified by anti-Black racism. And if we look at a life free of violence as a social determinant of health, when we have a situation in Canada, for example in Toronto, where Black people are 20 times more likely to be shot by the police or killed by the police, then we understand that violence as a determinant of health is driven and amplified by anti-Black racism. Another way of looking at it is in terms of Black individuals understand and look at health in, and many groups look at health and wellness in different ways. And as a Black person, I'm sitting in my home, and when I understand myself to be ill is very much determined by my race and my culture. Anti-Black racism, however, will determine when I leave my home to go and seek services outside. It will determine where I go first, who do I trust, what have been my experiences in the past, what's the delay in me getting to services or leaving my home to access healthcare services, and anti-Black racism determines how far those services are away from my community and where I live in terms of what kinds of services, health services in particular, are available to racialized communities across this country. Anti-Black racism is going to determine my economic level and whether I have the resources to even get to the healthcare service. And when I do eventually get to the healthcare service, anti-Black racism determines what my welcome will be or not be, what the intake process will look like. It will determine how I'm treated when I'm in the system, and anti-Black racism will determine how I'm sent back home. What we end up seeing in terms of outcomes are poor health outcomes for Black members of our communities in terms of higher rates of all of the chronic illnesses, stress-related illnesses such as heart disease, hypertension, diabetes, and chronic illnesses such as mental health and HIV. Those are the symptoms. Those are what we see are the symptoms of anti-Black racism in our healthcare system. And my last point that I'd like to make is that systemic anti-Black racism also creates a situation where we have a system that is unable to support Black people when they try to access services. There's a lack of knowledge of the issues and health issues concerning Black people. There are a lack of providers who are Black people or allies to Black people to ensure that proper health care is given. And we're also seeing it in all of the professional schools in terms of the difficulties we are having even accessing professional health education so that we can actually provide services for our communities.
Great, thank you for that, Natisha. I think you're really stressing that point that anti-Black racism interacts with every single determinant of health, which I know a lot of folks on the line may be engaging in various determinants. So regardless of what you are personally working on, there always is that intersection between anti-Black racism and the determinants. A lot of us on the line are actively working to improve for communities across the country. So thank you, Natisha, for getting us started there. Gaynor, I'd like to invite you to join in here with Natisha and share your perspective of what you're seeing as the impact of anti-Blackness on health and well-being.
you hear me okay?
Hi, Gaynor.
So, yeah, good afternoon, everybody, and thank you for this opportunity. So I would very much echo what Natisha has to say, and as a public health professional and public health physician, I would say that she's probably said it as well or better than I can. So certainly in public health, what we exist to do largely is to systematically identify and expose disparities in health status between groups for the purposes of seeing those disparities resolved. And sometimes we see that the disparity is easily resolved, and sometimes when we trace it back, we do in fact find those social determinants of health that Natisha has laid out at play. And so what we do see from anti-Black racism is that there is not an underlying contributor to those disparities that is not somehow worsened by the color of the skin of the person who's being affected. So Blackness in particular plays out as almost an extra kind of hit in terms of whether or not those social determinants will play in your favor or against you. And by the way, I would comment in addition to Sume's opening comments on the definition of anti-Black racism, that of course, the genesis of anti-Black racism in some degrees is related to a sense of visibility. So to the extent that Black people appear more visible than the majority white population around them, they stand out essentially as a target. And so the implicit unfairness of that, I don't think, can be underestimated. So the health impacts that Natisha has laid out, I think I wouldn't restate. It becomes very clear when you start looking at disparities in health outcomes and you trace them back to those large societal structures that impact everybody's lives, that there's a disproportionate impact in those large societal structures that happens for Black communities. But there's another level of impact that I would want to point to. And it's a very it's a type of impact that we can't necessarily track with our public health statistics, but it's nevertheless real and incredibly deeply felt in communities that I wouldn't want to underestimate it. And it's what I would describe as a sense of exhaustion. The impact of anti-Black racism for any of us as Black people is that we are exhausted. And the exhaustion comes from living in a context that you know is going to constantly find a way to remind you that you are not white. It's an exhaustion that comes from living in a context that is going to constantly remind you that no matter how you see yourself and how much value you attribute to yourself, the systems around you will not see that value the same way. They won't see you the same way. They will define you as they define you, and your definition of yourself and your worth means less. I don't want to underestimate the impact that that level of exhaustion has. It's exhaustion from sensing that you are constantly going to have to defend your right to be and to be seen as equal in contexts that otherwise don't understand you as anything other than Black and therefore different. And so there's something intangible about that, I recognize, and as I said, maybe less measurable than the disparities in health outcomes that I'm trained to measure as a public health physician. But it's what I hear when I listen to Black communities and when I meet with Black communities. It's what I experience as a Black health professional myself. And so I think it's worth pointing out that there are those types of impacts that have real tolls. They do play out in terms of the types of illnesses that Natisha has laid out, heart disease, cancers, respiratory diseases, mental health issues, addictions issues, you name it. All of those things have this contribution from this sense of exhaustion. What a colleague of mine, Dr. Omi Narom, who many of you know, describes as, kind of the additional minority tax that's put on Black people to be, sort of constantly defending and explaining and teaching and all of the things that go along with being visible and being reminded constantly that you are not part of the white majority. So I think that's all I would add for now.
Great, thank you for that, Gaynor. I'm seeing lots of folks in the chat box really echoing what you're saying about that exhaustion, and thanking you for raising that and bringing that into the conversation. So thanks for that. And just to add to what you're saying, there is a lot of research, right, which just shows exactly what Gaynor is mentioning, that this constant wear and tear, and some people have called it the weathering effect, right? That constant wear and tear and that constant stress does have a very direct impact on health, on stress, and things like that. So I think it's very real, and I am hearing it being echoed in the chat box there. And for everyone who is stressed, I would just add that there is this movement going on right now about rest as resistance, right? And just that is for those of us who are doing this work actively, making time. The problems are definitely huge, but making time to actually rest so that when you are ready to get back again, you have the energy to continue this work. So thank you for that, Gaynor. I'd like to invite you, Nana, to just jump in here and get this conversation. So Nana, I know you have spent some time in the health sector, in public health, but really, what else are you seeing there in the community as you do your work from a legal perspective? What impacts are you seeing? Okay, so Nana, if you're speaking, we cannot hear you yet, so you may need to unmute yourself using #6.
Oh, can you hear me?
Hi, Nana.
Oh, great. Hello, can you hear me?
Yes, we can.
Oh, that's great. Thank you, everyone. Thank you so much, Sumi and Dr. Emancipatory and Dr. Watson-Creed for those comments. So yes, at the Black Legal Action Center, we see the impacts of anti-Black racism every single day. Our mandate, our raison d'etre, is to provide individual and systemic level free legal services to Black people who are experiencing anti-Black racism in various areas of their lives. The intersection we're also seeing with race, with being Black, we also serve folks who are in low and no income. That's our mandate. So that intersection with class and race makes it so much more complicated. And so in the work that we do, we are constantly reminded, especially in this moment when we are grieving, we are exhausted, as Dr. Watson-Creed said, we are grieving the loss of so many Black lives, specifically at the hands of the police. At Black, we are reminded every day of the other institutions, right, that intersect with policing and who are complicit in enacting violence against our communities. So when we think about the impact of anti-Black racism in our communities, I'm reminded of how much fear exists for our clients. So when we speak to individuals who are experiencing anti-Black racism, let's say in their housing or with child welfare system or with their employer, we hear fear over and over again. They're fearful due to the constant over-surveillance that happens, not just from the police, and I want to be very clear about it, but from many other institutions. So I wanted to give 3 examples of that. So for example, in housing, in an area where our community is already disproportionately represented in housing that's deemed to be precarious or unsafe, including the shelter system, we're seeing, landlords say things like, all you people, or they're threatening to call children's aid when, a young single Black mom asks for necessary maintenance repairs, right? So when that threat comes, it lands very, very differently. Very, very differently for Black people. It creates a culture of fear and a culture of silencing, and this is why. It's because we are overrepresented in the child welfare system as well. So not just in precarious housing, but also in the child welfare system. So in Toronto, the research we have is that Black Canadians comprise about 8.5% of the population. However, young Black children represent over 40% of children in care. So if we are overrepresented in terms of the investigations and the apprehensions of Black children, when a landlord makes that kind of threat, that lands very differently, right? That creates that fear and that that constant over surveillance. We also see another example in employment. So you could have an employee, a Black employee who has had, great performance evaluations, but once that employee raises an issue of anti-Black racism or discrimination, suddenly, they're dismissed. They are told they're not a team player. They are put on a performance track measure, and that stress starts to increase, that fear starts to increase, and then we hear from the clients once they're off on stress leave, right? So there's different ways that that anti-Black racism affects us, and I just wanted to add that fear, that constant fear, spills over not just in policing, but in all other areas, and I think it's also experienced by the families and the folks in that person's life. The last thing I want to say is that the problem is it makes it less likely for us to turn to services when we are in need. So part of the work that we do at Black is to provide folks with a recourse, a legal recourse. You can go to the tribunal and file a complaint, a human rights complaint, or you can sue, or you can bring a complaint against the police. How likely are folks going to want to do that, Black folks specifically, when there is already this fear and concern about the services that we now need to turn to get redress? So I just wanted to leave it there in terms of my comments on that first question.
Great. Thank you so much for that, Nan. I think you're bringing in this examples of how various systems are intersecting in the health and well-being of Black folks. And I think I'd like us to come back to that when we get to our last question, and we're thinking about where do we want to be investing our resources as a society to improve the well-being of Black folks, and what is needed not just from the health sector, but really from every single sector in the country. So thanks. And I think the three of you have painted, a little glimpse. I know there's way more we can get into, but we wanted to just provide participants with just a sense of, little vignettes of what anti-Black racism looks like. And I know when you talk to folks, you get lots of examples. But this is another way of looking at what has just been shared. I think if you look at this model on the impact of racism on health, you can see examples of what Dr. Watson-Creed mentioned, Dr. Mascler mentioned, and what Nana shared, just about how you go from our institutions, right, and that impact, and across the board. I think the one thing which is very important to stress here, and Natsisha said this very clearly, is that anti-Black racism amplifies every single determinant of health. So it is not something which is mediated through, say, class, right? So if you think, hey, you're a well-to-do Black folk, and so this doesn't impact you. That is not true. The evidence doesn't support that on any level. So it's important that we really think about racism and anti-Black racism as something which functions outside of the other determinants of health and outside of things like social class and gender, and which really interacts with those to produce very unique and distinct experiences. I also wanted to highlight something in this model which talks about collective and individual resilience. It is in the fourth column under responses, the very last thing you can see. And I think we are talking about the impacts on health, but I just want to recognize that for centuries, for generations, across communities, Black communities are always actively resistant, either together or in individual ways, and that is the way. And those strategies are really how communities manage to thrive, even in the face of extreme racism and extreme hardship. And I think it's always important for us to remember that as we speak of this.